Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes, and we are continuing with our EMS Quick Study help here, and this is episode 31, but it's actually part 4 of the poisoning and overdose section and assessment and identifying some of these toxins. And of course, I always like to talk about why this stuff is so important, because when we talk about this type of content and how it relates to EMS, it's important, of course, for us in the field, right? Because we want to be able to identify what our patients might be doing, how they might be presenting to us, how we're going to treat them. And also, we want to also examine and know what we're going to be looking for on our EMS test, right? The type of questions that we'll often see on exams. And these study guides here, these quick study moments, are geared to help you pass tests more successfully, because I'm giving you pretty much the key elements that you will see on any EMS exam that you're going to take. They're very common topics and points that are often presented on questions and answers on EMS exams. Okay, so with that said, let's just talk about some of the types. And today we are talking about toxic gases, right? And one of the things we see are inert gases, right? These are the ones that really displace oxygen, okay, and cause injury or death because the patient will end up asphyxiating, okay? Things like CO, things like methane, hexane, propane, acetylene, and you're going to see things with these patients like an altered mental status, like seizures or even cardiac dysrhythmias. All right, these are some of the common things you'll see with patients who have had inert gases exposure. Okay, but what about irritant gases? These are the ones that affect tissues. Okay, they irritate the tissues. You have ones that are highly water soluble, and these irritate the upper airways. And then you have ones that they're less water soluble, and these end up passing through into the lungs and wind up causing severe tissue damage to the lungs. Now with the irritant gases, you've got some kind of levels here with these. We've sort of got an immediate reaction, which you can see like 1 to 2 hours after the exposure, and patients will have red mucous membranes, eye and nasal irritation, a cough, a sore throat, and maybe have some bronchospasms as well. And now the patients that are a little more delayed, this is where you've got more of a 6 to 24 hour window from exposure, and these are the patients who are going to have that laryngeal edema. Patients will be hoarse, stridor, and even have pulmonary embolism, but these are really the non-cardiac type of pulmonary embolus. And then you got the patients that are chronic, okay? And once they've been exposed to this stuff, they've got chronic issues where they've got this recurrent pneumonia going on and things like, advanced types of lung diseases. One other type we talk about toxic gases are those systemic toxins, right? The systemic toxins, and these are the gases that end up poisoning the cells themselves. Things like CO, things like cyanide, hydrogen, these all interfere with oxygen transport and delivery, okay, to the cells. And there's some other agents too out there that also damage things like the liver and the kidney, okay, these type of toxins. So all things to kind of look out for. But for us in the field, we're not really exposed to these all that often, okay? But we have to keep an eye out, because some of the more common exposures we'll have are things like, car accidents or industrial accidents and fires, okay, leaking tanks, truck rollovers that have, that are carrying these types of gases, and of course byproducts from fires, okay, or even reactions of different gases that kind of combine with each other. So all things to look out for when we come in contact with these things and where these toxins and where these gases might be coming from. Now, just real quick, we talk about pathophysiology. This really determines the effects of the gas inhalation, right? The water solubility of the gas itself, your breathing, the rate, how fast or how deep you're breathing, right? Even smell. If you can smell something, right, you can actually detect it and you can avoid it, okay? The concentration of the gas is going to affect, what type of symptoms the patient might have. And also the length of exposure as well. And believe it or not, even the difference in the patient themselves, right? Some people might be sensitive to certain gases. Okay, so keep that in mind as well. And also smokers, they have a low resistance to toxic gases, and COPD patients will also have a worse time as well if they're exposed to toxic gases. Now, primarily for us guys, we talk about management with these patients. Of course, safety is paramount, right? Protect yourself, protect your partner, all right? Protect other people on scene, okay? Do your ABCs, right? Your airway, your breathing, your circulation, okay? And you're going to treat the symptom. The patient needs oxygen, you give them oxygen. They need to be intubated, you intubate them. They need the IV, you give them the IV, all that stuff, okay? So you're going to treat the symptoms that the patient is presenting with, and of course, go from there. You're not going to, there's no antidote per se for a lot of these things. So it's really your ABCs, your scene safety, and you're going to be treating the symptoms of what the patient is having. So that's it for this session. Okay, next time we're going to talk about actually carbon monoxide poisoning. This is a toxic gas, of course, but I feel that it's important to kind of do a separate little session just on carbon monoxide, because this is something, especially for EMS, we get sent to a lot of those carbon monoxide alarms, right? So I think it's going to be kind of cool to kind of focus in a little bit on this gas itself and this toxin, and kind of give you some key elements here as well. Okay, so I hope you enjoyed this Monday Minutes, guys, and this quick study guide. I know sometimes I talk a little fast, and some of the words that I'm trying to pronounce don't come out right the first time like that. Okay, but I think you get it, and I know that the content is really what I'm trying to get out to, so you can see these key elements that you have to keep an eye out for. Okay, guys, follow me on social media. I'm over on Instagram, Facebook, Twitter, and also I'm on Snapchat as well. These are all of my links. You can just put emsseo.com with a / and either / Instagram, / Facebook, or / Twitter, and friend me on Snapchat again. It's EMS Safe on Snapchat. I do something a little different on each one of these channels. Always, I think, kind of interesting, kind of fun, and I hope engaging with you as well as being one of my followers here on YouTube or on the blog and whatnot. Okay? All right, guys, that's it. Again, any questions, comments, concerns, suggestions for a future Monday Minutes or EMS quick study tips, let me know. I'd love to create a session based on your suggestions. Until then, as always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.